Welcome to Dementia-Friendly Prince George's County, Maryland Northern Sector webinar series for caregivers. Today's topic is When is it more than forgetfulness? Presented by Ann Cranon and sponsored by the Prince George's County government in the Department of Family Services.
Hello, everyone. Happy New Year. Catherine here, just wanting to wish you a good evening. I'll be your facilitator for this evening. Dementia-Friendly Northern Prince George's County webinar welcomes you. And before we get started on today's topic, which is when is it more than forgetfulness, I wanted to just share a few housekeeping announcements. All attendees will be on mute during the presentation. If you have any questions, please put them in the chat box, which is located to the right of your screen, and we'll take them in the order that they are received. You will also be receiving a satisfaction survey following this evening's session. If you could just take a few minutes to respond, your feedback is important to DFA. We will send you announcements if you have subscribed to our email list. So if you enjoyed this event, or if you missed an event, you can subscribe to our dementia-friendly YouTube channel and watch previous videos on there. We will also be posting this on that channel for this topic. So without any further ado, it is my pleasure to welcome Ann Cranon of Ann Cranon Elder Care Solutions.
Good evening. I can't see a show of hands, obviously, but this is a topic of concern to lots of us, particularly as we get older and as we're caring for family. Like I was on a call with a family member, I'll say recently, and I thought, okay, is he repeating himself because he's kind of on his own a lot and just doesn't have a lot else to say, or is this an issue? And you know what? I don't know yet. I'm going to keep my eye on it. So that's my first thought, is that we just don't know right away. But do I have dementia? Will I develop it? We can't predict who's going to develop it. There certainly are things that, and we'll go into it, things that we can work on to try and prevent developing it. Let's see, I'm blocking my own screen with this little webinar thing. Catherine, how do I move? Can I just close this little GoToWebinar box, or will that cause some catastrophe?
I think you can. You can just close it or minimize it.
Oh, maybe that's dot control. Oh, nope. Okay, so I'm going to try closing it and hope I don't lose you. No. Are you sure when to leave the webinar? Well, no, I don't.
Oh, no. Okay, so if you, there should be on that panel, at the top, you see minimize, you see view in window mode, dot control panel to screen.
Wait a minute.
I can't see it.
Hide control panel. There we go. That worked. Okay. It was right in front of what I'm talking from. Sorry, folks. So obviously forgetting things is a part of life. This is why we have sticky notes. This is why I have numerous reminders set up in my smartphone to tell me, check on this, do this, take the trash out, whatever it is. And as we age, we might find that happens more, but that may or may not be a normal part of aging. So the question is, how do we know? Is it dementia? Are we forgetful? How do I know when to contact the doctor? There we go. So forgetfulness can be a normal age-related symptom. And there are other mental issues that can cause forgetfulness. The Institute on Aging reports that people experiencing depression, anxiety, etc., can be mistaken for having symptoms of dementia. being preoccupied with sadness, worrying about a recent tragedy. Frankly, like, if you're listening to the news, it can throw you off these days. And they can lead to forgetfulness that is not dementia related. And as we get older and there is more and more loss, when I was in my 20s and everybody was my cohort, my friends, my family were getting married, and then they were having babies. And then, and now, people are dying and people are having grandchildren. That's the age, that's the stage of life I'm at, that my friends are either dying or having grandchildren. My children are having children. But as when we get, depending on your family life, if a lot of that is happening, then forgetfulness is kind of a normal byproduct of that, because there's a lot of other mental energy going to other things. Transience is forgetting some memories over time, like the brain removes old memories, makes room for new ones. I've had one of my kids was telling me about something we did. They're swearing I took them to some train museum. I have zero memory of it. And I'm assured I do not have dementia, but I don't remember any train museum. Absent-mindedness can be related completely to our own focus. Like somebody's talking to me and I'm not really paying attention, so I don't remember the conversation. I wrote an appointment down, not on my calendar. I'm not going to remember it. I tell people all the time, the calendar is my brain. If I don't write it in there, it's not going to happen. I don't care if you give me a little reminder card. If it's not in my calendar, it's not happening. Again, normal parts of aging. I like this little cartoon, which says, for heaven's sakes, Harold, you're trying to change channels with a bar of chocolate. Now, that would not be a normal part of aging. And it's amusing, but not amusing. I had a woman I did an assessment with who was trying to show me how she would make a 911 call, but she was using the TV remote. Clearly, she wasn't safe alone in her home. So potential signs of dementia, unlike normal age-related forgetfulness, memory loss linked to dementia is progressive. It gets worse. We've had problems using familiar things, a calendar. I've had people like, can you write that on the calendar for me? Because they can't find the right month or the right day. They need somebody else to help change the channels for them, or to make a phone call. They can't make out a check anymore. They're still willing to sign it, but they want you to make it out. Those are things that would be of more concern. We're not talking about somebody who has a dexterity issue only, and sometimes they will present it that way, but you're forgetting important information. Like I'll ask people sometimes, what's your birthday? And they look at their daughter, when is my birthday? Okay, that's a sign of cognitive impairment. The loss of language skills, not being able to carry on a conversation. And sometimes we'll see people who are kind of withdrawn, and they get more withdrawn as time goes on. And we just think, oh, they've just gotten quieter. They don't have a lot to say. Sometimes they're not as good at putting a sentence together and articulating and jumping into a conversation. Personality change can also be a symptom of dementia. And then that can go both ways. I have had people who were kind of ornery become kind of docile, and the reverse, the docile become cranky. Disorientation, not knowing where they are, what time of day it is, that kind of thing. Dementia is an umbrella term, and I'm going to show you a graphic on the next page, but that's important. Think of dementia as an umbrella, for the loss of an umbrella term for the loss of memory and other intellectual abilities that are serious enough to interfere with daily life. Alzheimer's is one of the things under that umbrella. It's the most common type of dementia, but it is by no means the only type. But many of the resources put out here for Alzheimer's dementia or Alzheimer's disease are useful for the other types of dementia. Maybe not 100%, but you don't want to look at something that says it's, for people with dementia, it might be very useful if you're dealing with another type of dementia as well. So here's that umbrella, and you can see there's a lot of things, and there are others that can cause dementia or the symptoms of dementia. And whoops, we're going to just talk about the demographics. I just looked up these numbers today, and they are higher than they were when I gave this talk 2 years ago. Over 348 million Americans, approximately 18% or 1 in 6 are over 65. That's because the baby boomers, we are reaching that over 65 age. Approximately 7 million Americans currently have Alzheimer's disease. That's about 11% of people over 65. So it's a growing problem because the population is aging. 1.7% of people 65 to 74 have a diagnosis of dementia. So that's a pretty small percentage of the 65 to 74. 5.7%, 75 to 84. You can see a big jump at over 85. And while it's still not huge numbers, it is the biggest health concern for adults aged 25 to 40 is developing Alzheimer's disease. That's what everybody's worried about, because you feel like you're not you anymore. If you're going to have dementia, you feel like that's what might happen. So the 3 Ds are really important. That's dementia, delirium, and depression. They can coexist, and they can also be mistaken for one another. Like I was saying earlier, somebody who is suffering from depression might be mistaken for having dementia because they just can't be bothered to answer the questions or to focus on the information that's been provided. Delirium is more like a confusion that is, what's the word I want? Temporary. So you can have a delirium, like there's ICU delirium or ICU psychosis. You can have a delirium from a fever. You can have a delirium from the flu. It's a confusion that is temporary. So again, we've got diseases that are linked to dementia, and you've got Alzheimer's, you've got vascular dementia, Parkinson's, Lewy bodies, which is what Robin Williams had, I believe. Traumatic brain injury can cause dementia. Down syndrome, a much higher percentage of dementia among people with Down syndrome. Then there's Wernicke-Korsakoff, Creutzfeldt-Jakob, FTD, primary progressive, and their primary progressive aphasia. And there are more. That primary progressive aphasia is that loss of that ability to communicate. And my mother was never diagnosed with that, but she was one of these people with dementia who just kind of faded. She didn't develop any really difficult behaviors, but she just talked to us less and less and kind of faded. So symptoms of dementia would be language impairment, memory loss, disorientation to time and place, and an important one is somebody showing poor judgment. To be classified as dementia, you've got to see 2 of those symptoms and serious enough to interfere with daily routines. Now, I will say, let me see what my next slide is real quick. Yep, okay. Memory loss, not always a symptom of dementia, can be, like I said earlier, just you're inattentive, you've got other things on your mind, whatever. Disorientation to time and place. I get up in the middle of the night or when I've been traveling and you get up somewhere and you don't know where you are. This does not mean you have dementia. Poor judgment. And I think about my dad did not have dementia, but he was very upset one time. He did a lot of investing and he paid attention. He did his own stocks. He did not have a person who managed them. And he made a bad decision one time. We can all make bad decisions. We are entitled to make bad decisions. And I often say, you know what, if I want to go bungee jumping, would demonstrate poor judgment on my part, but by golly, I'm allowed to make a bad decision. And the fact that I'm over 65 does not mean that I can't make a bad decision or that I shouldn't be allowed to. So I think you just have to be careful about jumping too quickly to mom or dad is showing bad judgment. It's what did they show before Do they recognize that they made a poor judgment? We can't prevent every bad decision or the consequence of every poor decision. Let's see what we got here. Oh, other things that can cause, I won't say dementia, but signs of dementia would be an infection. Somebody has a UTI, an electrolyte imbalance. Those are common things that happen. And if you see a sudden change where you're wondering if somebody has dementia, but gee, 2 weeks ago, a week ago, they seemed fine, that is time for an immediate doctor visit. It could be a nutritional deficiency, vitamin B deficiency. It can be thyroid disease, can be depression. It can be interactions of medications. It can be they've had a fall, a head injury, they've got a brain tumor. And I've had people have falls and nobody knows they had a fall. And we go in and I've had a client get checked and, oh, she's got a bleed on her brain, but she was at home and no indication of a fall. People with a history of strokes, somebody with alcohol abuse, these can show signs of dementia or signs similar to dementia. Sorry. So dementia, not a natural part of aging. It's caused by one or more diseases or conditions that affect the brain. While it is related to age, it's not a part of healthy, normal aging. And important to say, on the list of dementias, you will often see mixed dementia. And the thing is, all of those diseases more likely with age. So people would be common to find somebody who has Alzheimer's and vascular dementia, or Parkinson's and Alzheimer's, or one of several things causing the symptoms. So natural aging, you make a bad decision, fine. Dementia or some other cognitive issue would be they make a bad decision, can't recognize it, and think it was a good decision. Natural aging or natural anybody, you miss a monthly payment. Dementia could be difficulty making out a check. And like I said, not the physical writing. Forgetting the date, normal. Can't use a calendar, not normal. Could be dementia. Forgetting somebody's name, and I do this a lot, but remember it later. And, just can't come up with it, normal. Can't recognize somebody you know, not healthy, not normal. Lose your keys. I lost my wallet today, by the way. Found it, so no dementia. Can't figure out how to start the car, that would be dementia. Forgetting a phone number, but not knowing versus not knowing how to use the phone. That's kind of how you look at the difference. And to be fair, when people reach 75, 80, we're a lot more alert to, oh, maybe something's wrong. Maybe something's wrong. Maybe it's not. Maybe they're a little slower than they were. Maybe they forgot something. Maybe you would forget something too, Let's see. So top 10 warning signs, memory loss. So the one thing to look at with memory loss is, and people will think, oh, but my mom's memory's good. She's telling me about, something that happened when we were children. New memories versus old memories. It's important to look at. If she can't remember what happened yesterday, last week, this month, that is a warning sign. The older memories are just more firmly established. It's that ability to make new memories when that is impaired that we get concerned. Misplacing something and they're unable to retrace their steps. Notice I said their and not your, because I don't want to think about this. I was looking all over for this wallet today and I went out to my car. I'm looking under the seat because I knew I'd had it out. And it was in my house on the kitchen table under a book that somebody gave me as a gift and dropped off. And so it was on top of my wallet. But if I had no idea where to look for this wallet and I'm upstairs checking out my bedroom drawers for my wallet, which has not been upstairs in years, that would be a concern. So that inability to kind of go back and say, okay, well, I was at the grocery store, I was at the doctor's, and retrace where you've been. That inability to do that is more concerning. Problems with language, and I always hesitate to say this because when you get to be a certain age, word finding can be an issue. And I was told that after menopause, women have a harder time finding nouns. I don't know, but I know that I did see in myself a little bit of a word finding issue. But so it's not just, can I name something, but can I identify? I pick up a hairbrush, I know what it is. I know how to use it. And I can communicate with my children, my grandchildren about this. And the word finding, that's where it starts, but it becomes more progressive. Poor or diminished judgment. And that's that not realizing whether something they did was a poor choice or a poor decision. That's what distinguishes it from, gee, we just made a bad decision. You know what? I bought that meat on sale and it wasn't good. Or I ate meat that's, been out of date in my refrigerator for 3 weeks. That's bad judgment. Disorientation to time and place, mixing up day and night, getting lost in familiar places. That would be, and again, an isolated event, you took a long nap, you woke up, it's dark, it's a little confusing. That can take you a minute. Difficulty performing familiar tasks. People who no longer know how to work the microwave. That is assuming they had a microwave. If they've never had a microwave, that's not a good test. Those are the kinds of things, a familiar task. The washing machine, they can no longer wash their laundry because they don't know how to use the machine. Diminished abstract thinking, can't see the big picture. They're very focused on, we have to do this. They can't look at the bigger picture. Loss of initiative. And this can be something that people do because they're aware of a change. They kind of start self-isolating. I've had people not comfortable going to church anymore because they can't really hold up their end of the conversation, or they feel like it's going to be obvious if somebody asks them. Changes in mood or behavior, changes in somebody's normal personality. Even if it's somebody young and you see these things, that I'm not saying it would be dementia, but these are reasons that you would take somebody to a physician, is not a one-day change in mood or behavior, but an ongoing change. Let's see. So, ways to prepare ourselves. Get a diagnosis as early as possible. If you have these concerns, you're not just, gee, I forget where I set my keys down, I can't find my wallet, but significant forgetfulness in either yourself or others. Go to the doctor, express the concern. Do your legal and financial planning, or persuade your person to do that, because legal and financial planning have a window of opportunity. And if you wait too long, they may lose capacity to make those decisions. And that makes things way more complicated. Then you're looking at guardianship, courts, and costs that are much more involved. Investigate the available resources like Dementia Friendly America, like the Alzheimer's Association. I'm a care manager. If that's something you need, you look for a care manager. Get yourself educated for yourself if you're seeing these signs, or if you're seeing these signs in a spouse, a parent. Start getting educated, and really important is enlisting assistance. And I think that's an important thing, is that building your little private army, your support group. There are support groups that you can join, but your own personal support group, the other members of the family or neighbors. I've had clients where a neighbor says, is to contact them if mom's newspaper didn't disappear in the morning. Of course, I don't know how many people are getting a newspaper now, but or the lights aren't going on at night. If they, whatever they see that a neighbor would let them know. So they're all part of your your support group. And we all need that in many ways. Let's see what's on the next one. Okay, and then really important, even if you think you already have an issue, is managing your health conditions. If you have diabetes, managing blood sugar, managing blood pressure, these are important to minimizing risk of developing dementia or of dementia progressing. Eat a heart healthy diet. Hearing loss, really important, because hearing loss leads to social isolation. Isolation is one of the predictors of developing dementia. Staying mentally active, and there are all kinds of ways to do this. You can do it in a, depends on who you are. Like I have, in the last year, I've picked up sewing again. I haven't sewn in many years. It's kind of an effort. I'm having to relearn things, and that's good for my brain to have to relearn something new a language, take an art class. Somebody told me upper level math. I haven't had the bravery to try an upper level math class yet, but those are the things that make us think and use our brains, and our brains need to be challenged. Watching television is very passive. We do not have to, even versus reading a book. When you read a book, you've got to read the words, your brain translates it. You've got to, if you're reading a novel, create an image. If you're reading nonfiction, you're following the paths of what happened. In television, you can sit there and it just goes across the screen. You can engage with it if you really work at it, but you can also sit there very passively. Not particularly good for our brains, the amount of television that most of us watch. This is the staying connected. And I've had people say, okay, well, I don't have a family. I don't have family. I'm an orphan elder, which is what we call seniors with no family. And I'd say, find a way to build relationships, join groups, join a book club. If you're kind of an introvert, join a book club, volunteer somewhere. Those are anything you can do to stay connected and or develop additional relationships is really good for you. And it's also part of building that network, so somebody recognizes, oh gee, something's a little off. Keep alcohol within recommended limits, also really good at helping maintain brain health. Stop smoking if you're a smoker, also important. Okay, that's the end of the presentation.
I thank you, Anne, again for all the information provided. Thank you everyone for your questions. Really appreciate you being on here. Just another sign that you're being proactive and trying to get as many resources and education to help you as a caregiver, perhaps to a friend or a loved one. We'll catch you next time on our presentation. And if not, you know where to find us on our DFA YouTube channel. That's Northern Prince George's County DFA YouTube channel. Thank you so much, everyone, and have a good night.
Bye.